Gender reassignment surgery helps individuals change their bodies with plastic surgery from their assigned sex at birth to fit the gender that they identify with. Currently, 18 is the minimum age for all cosmetic surgeries, including gender reassignment surgeries, and the age for taking cross-sex hormones is 16. Young people experiencing gender dysphoria can take puberty blockers before they are 16 while undergoing puberty, as this is advised to be a reversible treatment. When they reach 16, if they have taken puberty blockers for at least 12 months, they can then start taking cross-sex hormones, which cause some irreversible changes, such as breast development while taking estrogen or voice deepening while taking testosterone. Although some people believe that under 18 should be allowed to give consent and undergo these procedures, the government has placed age limits on these treatments and surgeries so that young people are old enough to know the severity of these surgeries and give informed consent on the permanent changes to their bodies.
The earliest practices of medical and surgical intervention in gender transitions can be dated back to the beginning of the 20th century. However, it was not until the end of the century in which gender affirmation care in adolescents started to emerge. Currently, there is still a lack of research in gender reassignment in minors, but also into the long-term effects of less extreme and/or reversible medical options, such as puberty blockers, in which those under 18 wanting gender affirmation care are limited to. Despite this, gender dysphoria, distress that is caused by a discrepancy between a person's gender identity and that person's sex classified at birth, is statistically most prominent in young people. This is possibly due to development through puberty and increase in social standards and divisions. Not all gender variant people experience dysphoria, and so everyone's needs and transitions will vary. However, some studies argue that by denying treatment is to force them into experiencing a puberty that they will face with dread and take away from the teenage years that they should enjoy as their true selves. So why is gender affirmation surgery limited to those over 18?
Minors are still in the process of developing their cognitive and emotional capacities. Respecting autonomy is vital, but it's equally crucial to acknowledge that the decision-making abilities of minors are not fully matured. This raises concerns about their capacity to provide truly informed and irreversible consent for a life-altering procedure like gender reassignment surgery. While early interventions may be presented as beneficial, the evolving nature of adolescence suggests that a stable gender identity may not be fully formed. A 2015 Boston study found increased risk of psychiatric disorders in transsexual youth who underwent gender reassignment surgery, emphasizing the need for a cautious approach to protect the minor's overall well-being. Adopting a stance that restricts gender reassignment surgery to individuals over 18 aligns with ethical principles like respecting developing autonomy, exercising beneficence with caution, upholding non-maleficence by minimizing the irreversible interventions, and promoting justice through fair and equitable access to healthcare resources.
The decision to undergo gender reassignment surgery before the age of 18 is a huge choice to make alone. Therefore, it becomes the responsibility of the clinicians who have previously referred and/or performed the gender reassignment surgery, and they should be held accountable for this irreversible decision. Both medical and mental health professionals are crucial in the steps leading to the life-changing surgery. For instance, this can be through evaluating whether the patient is ready for surgery to change their gender, taking things like mental and emotional well-being and the duration and severity of gender dysphoria into account. It's important to note that the decision to undergo gender reassignment surgery shouldn't be rushed and ambiguous, especially in the case of minors. There should be clear guidelines and better standards of care to guide healthcare professionals on the assessment of individuals wanting to transition, including the support and care after the surgery. Healthcare professionals have a duty to inform patients with clear information and carefully assess the patient through multiple meetings to be able to fully understand where the patient is at currently. Ultimately, while gender-affirming care is still evolving, it is intended to ensure a thoughtful and clear decision-making process. It is the responsibility of these clinicians to provide a highest standard of care to comply with the needs of these underage patients through a system that is transparent, safe, and comprehensive.
We do agree with the current laws in place that it is not ethical for under 18s to have gender reassignment surgery. This can prevent young people undergoing surgery without being fully aware of the severity of their decision and potentially regretting this choice.